And I want to yield to a friend of mine who we worked on a variety of issues together and will continue to, who's a great member from Rhode Island and a very dear friend, Mr. Langevin.
I thank the gentleman for yielding, and I just want to echo your comments because you're right on target. Clearly, in the United States, we have a healthcare system that is broken. We're in crisis, and it's unsustainable. It is clear when you look at statistics from around the world that we have the highest outcomes, the highest cost and yet the worst outcomes when it comes to healthcare, and that's because when you look at the number of uninsured, when you aggregate it, almost over 47 million Americans without health insurance. That is the reason that we're on a path that we cannot sustain, and it's not serving anyone in terms of delivering good health care and good quality when we have a system that has so many uninsured and that we're spending our dollars so inefficiently. So I want to be here tonight to add my voice to this clarion call for health care reform. I want to begin, of course, by thanking my colleague from Connecticut, Mr. Murphy, for organizing this special order to discuss health care reform. I thank Mr. Ryan for his contributions to this effort tonight, and the other speakers that have spoken or will speak later. Let me say that I believe that we need to really have a frank discussion, an honest discussion with the American people about this issue. It's an issue that directly impacts everyone in this country, individuals, families, businesses, at every level of our government. Regardless of one's age, gender, race, religion, or income level, everyone has a direct stake in our healthcare system, and it's important that Americans are properly informed of their choices as Congress moves forward with healthcare reform. Now, I think every member of Congress certainly is in agreement on one fact: that our current healthcare system, as I said before, is not sustainable. And now, I'm really disturbed, I have to say, by allegations from my colleagues on the other side of the aisle that in proposing real solutions that offer substantive changes to the status quo, we're somehow seeking to socialize medicine or ration care. I think this is something that we should address. So I'd like to offer some insights into this issue, some clarifications on this point. Now, first of all, the thing that we must acknowledge, and Mr. Ryan was talking about it earlier, the unfortunate truth, is that we're already experiencing rationing under the current system. We experience it when insurance companies deny individuals coverage based on their health status or pre-existing condition. We see it in the millions of families whose premiums and co-pays are so high that they have to forego basic care and life-sustaining treatments or choose between medications and groceries. We see it in businesses that can no longer offer insurance as a benefit to the employees, not because they don't want to, but because they can't afford it. Each of these circumstances represents a form of market-based rationing, a basic failure of our current healthcare system, of our private health insurance markets, due to skyrocketing costs. Now, I want to be very clear to my colleagues and to the American people that reducing costs and expanding health coverage to all Americans doesn't mean reducing quality, access, or choice. On the contrary, we can and we must use the money already in the system more efficiently to ensure access and expand everyone's choice of insurance coverage, doctors, and more effective treatments. Now, the most recent draft of the House proposal, while far from a finished product and far from perfect, does build on the strengths of our current system, the employer-based system, and then supplements that with a health insurance exchange. Now, what does that mean? Well, it means that Americans who are happy with their current health care coverage can keep it. But those who don't have coverage through their employer will be able to shop for their choice of a private health plan, just like federal employees and members of Congress do. Now, they'll also have the option, of course, to choose a public plan alternative, which I think is vitally important. Now, those Americans who cannot afford to purchase insurance in the private market will receive assistance in paying for the coverage that they do choose. Now, under this new system, private health insurance companies will have to play now by a new set of rules. The insurers are no longer going to be in the driver's seat. We're putting the American people in the driver's seat. We're going to make sure there's a basic new set of rules in fairness in our health insurance system. And again, health insurance health insurers will no longer be able to deny coverage based on a person's previous health condition, and they'll have to participate in a more transparent and competitive marketplace. Now, this means reducing out-of-pocket costs or unexpected fees when patients become sick and need the care that they have paid for and have been promised. Greater transparency will translate into more manageable costs so that when we open our bills or statements, we know exactly what we're paying for. Most importantly, under this vision of health care, doctors and patients will make medical decisions, not insurance companies or the government. I cannot overstate this point enough. Medical decisions should always be left to the patient and his or her health care provider. And that's what we're going to ensure under the system. Now, this is the health care system that we can and we must strive for, one that offers stability for families where coverage is not lost because someone changes or loses their job or becomes unexpectedly ill. Now, these are, as we know, without a doubt, challenging times. We face extraordinarily high unemployment in this country. In my home state of Rhode Island right now, the unemployment rate has reached 12.1%. This is on my mind every single day when I come to work. When I go to sleep, the first thing I wake up with in the morning is this on my mind, and how do we fix that, get our economy back on track? Well, fixing health care is going to be vitally important to do that, because the current status quo is just unacceptable. Even more unacceptable is that every job lost places access to even the most basic health care coverage at even greater risk. Now, just as I conclude here tonight, let me just say this, that in a nation that has led the world in health care innovation, every citizen should have access to affordable, high-quality care. I believe this to be true not only for moral reasons, but because this is what will ensure that we remain the global leader in healthcare innovation in the 21st century, and it also makes sure that our workers and our businesses will continue to be competitive in this global economy in which we now live. I urge my constituents and Americans from across the nation to engage in a real, honest, clear discussion on healthcare reform and to demand a universal healthcare proposal that puts the American people first. I'm just proud to be able to join the special order tonight talking about the need for healthcare reform. I again want to thank and commend the gentleman, Mr. Murphy, for organizing this event. Pleased to be here with you and with Mr. Ryan and with all of our colleagues who care passionately about healthcare reform. This is our time. This is the year when we are going to fix healthcare in America once and for all for the American people. And I thank my colleagues and I yield back.
Well, I thank the gentleman. Mr. Langevin has been such a great leader on this issue for a very long time, and I think he's right to counsel us that this is our moment. But it's no